can do more than disrupt your daily rotation. Instead of prolonging the pain, you can restore your mobility and preserve your joints. Welcome back, orthopedic surgeon Dr. Brian Flowers with Sterling Ridge Orthopedics. Hi there. We kind of touched on earlier how, you know, not every place is the same. And so when it comes to Sterling Ridge, what specifically is it about this group that can make life a lot easier as a patient?
Well, I'm really proud to be a part of this group of doctors. What we can do is we can do joint replacements, which most orthopedists can do. Then we can also do joint preservation techniques, which is pretty unique, as well as Oates procedure, which is done by my partners, Dr. Bill Hayes and Dr. Keith Johnson, who can actually do cartilage transplants to help focal areas of arthritis rather than just trying to get rid of the entire joint.
Yeah, and you have, like, you know, the therapeutic, the equipment, all that type of stuff, all the diagnostic equipment, all that stuff under one roof, so you're not running all over town.
It's us. It's physical therapy. We have an excellent physical therapy staff, and we have our MRI, and we also have a surgical center, a surgical hospital, Lake Woodlands, and Umble Surgical that we work out of. So
another things that you have, and like you mentioned, preserving the knee and or ankle joints in particular, because oftentimes we think it's all or nothing. You replace it or you get nothing done. There are some things in between. So let's talk about like the Taylor spatial frame, for example.
Yeah, so it's this frame here. What we can do is use this frame to gradually adjust the orientation of the bones. If you happen to have bow legs or knock knees, what we can do is get the uneven pressures of the knee that results from those deformities. We can straighten them completely out to ensure that you have the lasting effects and decreased wear on the joint throughout your life.
Yeah, almost like braces.
Yeah, exactly.
If you will.
Exactly.
Okay. Next is the complex reconstruction and deformity correction that you can do as well.
Right. So this frame is, I like to call it my little Swiss Army knife.
I'm about to break it up.
So what we can do is use this to distract the ankle. And when there's ankle arthritis, we can inject stem cells into the ankle, help regenerate cartilage, but it's important that it's non-weight bearing during that time. So what this frame does is it attaches to the legs with wires and with screws, and then we separate the ankle joint so that they continue to walk and they can move their ankle.
That's really interesting, because in a lot of cases, you know, obviously with orthopedics, somebody either has injury that they've caused to something, or arthritis being one of those #1 things that just kind of wears our joints out. And so by doing the stem cell and restoring, so any method where we can help the body help itself.
Right. We've had great track records in the ankle. We're working on the knee now, but absolutely, yep.
Okay, there are times when we would do a partial, times when we would do complete replacements on some things. What determines that difference, and how do you all handle that? Well, this is interesting right here. What is that we're looking at?
So this is a 14-year-old girl who has that same frame I was just showing you, where she had a cyst in her talus. It was causing her a lot of pain, and she was on the verge of collapse of her talus bone. So what we did was we separated the ankle joint, injected stem cells as well as bone graft, allowed it to heal in, and now she has full, complete function.
Wow, that's amazing. All right, so back to when we would do a partial, when we would do a full.
Sure. So it depends on a few things: X-rays, MRIs. If there's a certain population that, if it's a focal area of disease, we don't have to do a total knee, which is what most people can get. You can also, and that's the X-ray showing right there, but if you can compare it with what a partial knee replacement, it's much less invasive. It remains there. There's the X-ray right there. You keep a lot more of the native bone. A lot of the mechanics are the same, because you don't remove the ACL, the PCL, or the collateral ligaments.
Yeah. And I want to end with, a lot of folks know they have a problem, but they put it off. They put it off because we don't like surgery, but they need to know a couple of things. One is, surgery is a lot different today than it may have been years ago for our parents and grandparents. Exactly. And also the materials are different today. They could be longer lasting. Right.
Well, the biggest improvement in the over the past 15 years in total joints is the piece of plastic in between that little white piece of plastic right there. And they've really made high inroads in making sure that it has a long wear life. So these last between 15 to 20 years, and the process of getting it in is more or less the same, but we do have new machines in the operating room to minimize bleeding and minimize nerve damage.
And my mom went through it at 89, and she's like walking the malls. Every time there's a sale, she's up there, 89 years old, walking the malls. All right.
It is one of our best surgeries that we offer in orthopedics. It really is.
Thank you very much. Dr. Flowers operates at Humble Surgical Hospital and Lake Woodlands Surgical Center. If you'd like more information on joint preservation procedures, you can contact Sterling Ridge Orthopedics. Here's the number. It's 281-364-1122, 281-364-1122, or log on to srosm.com. Still to come, he plays a violin actually older than America herself, and he'll perform for us straight ahead. Plus, the lady